Welcome to tigerLAB Bites, a content stream that informs, inspires and brings us together. tigerLAB Bites brings you into Curzon building, where you will meet the lifeblood of our university, those that initiate and transform thoughts and minds. Of course, I'm referring to our academics. So in this episode of tigerLAB Bites, we're going to learn about telemedicine, a new word in my vocabulary. I'm here with Economics Senior Lecturer Erez Yerushalmi. Erez, so tell me, what is telemedicine?
Hi Raaj, so thanks for inviting me to this tigerLAB's episode. Telemedicine, in a nutshell, is the practice of caring for patients remotely and the distribution of health-related services and information electronically. So recently, innovation in technologies, as well as the COVID-19 pandemic, have enabled us to go more digital and change the way we work. So for example, more and more of us are working remotely and connecting to people through the computer. So in terms of healthcare, a growing approach for providing healthcare services is the use of telemedicine.
Okay, so I can see this being a very important innovation. So tell me a little bit more about the subject.
So in the past 2 decades, the demand for healthcare has been steadily rising, but the supply of healthcare has not caught up with the demand. Governments are trying to find ways to increase the supply, but because resources are limited, it is important for them to make sure that the new services that they're going to deliver are a good value for money. So the common approach to do this is to compare the economic benefits of the new device or the new service with the cost of providing it.
I understand there's many types of telemedicine. So what did your research particularly focus on?
Okay, that's interesting. So in the course of my research, I learned that telemedicine can be grouped into 3 types. The first is telemonitoring. These are mobile devices that link to platforms that conduct medical tests and communicate with healthcare professionals in real time. So for example, we have smart wearable devices that can monitor our body, our pulse, blood pressure, and make an eye examination, and then send the information to a monitoring and evaluation station.
And I guess that's a bit like sort of your phone, your watch connected to your phone.
Yeah. Then the second is store and forward. This is basically digital storage and the sharing of health records across the healthcare system. The idea is to give a timely and efficient accessibility of patient health records across a variety of different healthcare providers. So, for example, whenever we make a new appointment or get a clinical result, our data is stored and quickly retrievable by the doctors that treat us.
Efficiency.
Yeah. Finally, we use interactive telemedicine, which is the direct real-time communication with patients. So, for example, we can use our smartphones or computers to communicate with healthcare providers.
Yeah, I can see that. Sort of over the COVID period, I had a diagnosis made via my smartphone.
Oh, my wife had something to do with physiotherapy.
Wow. Okay, Erez, so we've got a question from one of our students. Over to you, Farida.
Hi, Raaj. My question to Erez is, tell me more about your project on telemedicine. And does telemedicine have an economic benefit?
In this project, we chose to study Canada, which is a developed country with a strong public healthcare system and a large rural area. This means that people living in those regions require many hours of travel time to get to their healthcare appointments. What we do is simulate changes to the Canadian economy by introducing more telemedicine into the healthcare services. So currently 4% of healthcare visits are done using telemedicine in Canada. In our model, we simulate an increase from the actual 4% to the 10, 25 and 50%. So by using telemedicine, people save a lot of time. So for example, we save a large amount of time traveling to the actual healthcare appointments. And in rural areas, this could take a person 8 hours to travel to the GP. And in dense cities, people might be simply stuck in traffic for a long time. And in addition, we waste a lot of time in waiting rooms before our appointments actually start. So to find the economic benefits of telemedicine, we calculate the save time and convert it into a monetary metric. So as GDP is connected to hours we work, with more time available, we lose less GDP. In addition, we actually gain time for leisure activities, such as watching a movie, relaxing, preparing a meal with the family. This adds to our well-being, but well-being is really difficult to measure in terms of in terms of money. So our approach measures both the rise in GDP and the rise in the overall well-being. Specifically, our model uses a simulation method called computable general equilibrium. In this model, all workers, firms, and government services are interconnected. When we introduce more telemedicine, there is a positive ripple effect throughout the economy, which we capture and measure in our model in our computer simulation.
I can really sort of see that, the economic increase and also the well-being increase. We've got a question here from Martin. Professor Martin Levermore, over to you, Martin.
Raj, my question to Erez is, what were the results from his research?
So first we had to calculate the number of hours we believe would be saved when introducing more telemedicine. To do this, we linked the average number of visits per treatment type, population density, and clinic location with assumptions about the average speed of travel. So in this figure, you can see that the redder areas are more heavily populated, and the small magenta circles are where a healthcare clinic is located. We also add the total hours used waiting in the waiting rooms before actually meeting the healthcare providers. Together, these give us the total number of hours per year that we initially use for face-to-face appointments. Then we introduce different levels of interactive telemedicine. So what we find is that if, for example, Canadians would replace 50% of their healthcare meetings with telemedicine, this would translate into 100 million hours per year of saved time.
Wow. And
in terms of money, this adds nearly 3 billion Canadian dollars of GDP, or around 0.15% of GDP per year in terms of growth. Also, as I mentioned previously, we also calculate the rise in the non-measurable well-being amount by having more leisure time, which we quantify. We also provide that in the research. And the last aspect that we will continue looking at is the impact that telemedicine actually has on the service quality, because it's not 100% sure that more telemedicine provides more quality.
Yeah, I can sort of see that. So you're looking at the cost, the non-measurables, and finally the quality. So Erez, your research will continue looking at this, and on our video we'll add more links to Erez's research as he progresses with his team. Thank you very much, Erez, for coming on tigerLAB Bites, and we'll see you next time. Thank you.